What's up, everyone? Welcome to the 35th episode of Super Brain Radio, the protocols episode for Chapter 7, Misfiring, which I have to confess to you all has actually been in the moment physiology 101 in disguise. When I talk about the management of performance, like I've introduced in the past, or when people ask me what I do for work, and I tell them that I manage performance, that I don't necessarily coach performance or plan for performance, it actually is encompassing something totally different. We've already alluded to what management means. It means encompassing not just the planning, but the actual fostering of greater sports performance right before. The ensuring that things go as they should during, the restoration after. This is not typically involved in a plan because you don't plan for these things. In fact, you cannot. It's totally just an asinine prediction. But it's still something that needs to be managed. And thus, I wanted to introduce what it means to manage performance in a novel way. So that's why I decided to make this chapter the introduction to in the moment physiology in disguise. What I mean by that is we can't periodize vagus nerve function. We cannot periodize hypothalamic change relative to sport. We can't periodize your feelings, and we can't periodize away from underperforming. And if you understand the premise of periodization, meaning a progressive and systematic increasing in difficulty in variables in a subsequent manner to get you from point A to point B in a sports performance setting, if you look at what that really means, these factors I just mentioned, again, the vagus nerve, the hypothalamus underperforming, and we talk about feelings, you start to realize that these things are, one, fluctuating far too quickly, two, constantly a model of athlete perception and not biology, and furthermore, it's not something where you can say this is the optimal card to play. If something happens to you that's very, maybe degrading, hurtful, right before a sports performance competition, and you suddenly get to the event the day of and realize that amygdala card, that little bit of aggression, that rage, that inner drive to push back is there, and it's maybe positively correlated with what you're doing, might not be the worst idea to play that card. And in fact, when we talk to athletes who have had something like this happen to them, they all tell you that that may have been an exceptional performance, but they can't replicate that with the same mindset if there wasn't something to happen prior. So what that really means is when it comes to encompassing feelings along all the other variables I mentioned, we start to see that it's a true day-to-day, maybe even hour-to-hour phenomenon. Therefore, periodization does not have the tools that we need to manage hour-to-hour physiology. And when I introduce a mentee to in the moment physiology, and I talk about the vagus nerve, the hypothalamus, so on and so forth, they're all things that you simply cannot talk about from a language-based perspective in other modes of looking at it. If you were to look at it again through a sports performance periodized plan, or look at it over what do we want our vagus nerve to do for the next 8 months, they're just inherently stupid questions. They do not have an answer because they're stupid questions. And yes, I do believe stupid questions exist. Furthermore, as we start to now move into the protocols, I'm actually going to dissect one by one, which is something I haven't done in the past. And that's going to allow us to see how different the management of performance is rather than the actual planning for performance. So when we talk about the vagus nerve, and its expression of tone increases, as a reminder for you all, we see heart rate, blood to the stomach and lungs and respiration rate all drop to a more beneficial range, if you will. And I only say beneficial maybe because of cost and associated feelings, if you will, because the feelings associated with your sympathetic nervous system being accelerated, the vagus nerve decreasing its expressed tone, and we move into that other direction where we see less blood in the stomach, we see cardiac excitement due to epinephrine, and we see respiratory fluctuations, meaning there's periods of hyperventilation, the same way there may be periods of hypoventilation based on the typical cadence. We also start to notice that sometimes these things are good. If you're participating in something for a long period of time that involves many detailed or very different from each other variables, and there's a lot for your visual perceptual cortex to manage, we are going to hope that we are actually in our sympathetic nervous system, because it's the only way you're going to be successful here. So what it really comes down to is the 3 bullet points at the bottom, and we're going to apply them again and again to the hypothalamus, and then as we talk about the rest of the episodes. So let's look at the vagus nerve and identify what behaviors, biomarkers, and enzymes are needed for success. So maybe your task is darts, and you just want to get that center bullseye. Well, behaviors that involve success are going to certainly be a quiet brain, are certainly going to be increases in the 5 senses through fine motor skill, which is also going to say we need biomarkers that involve oxygen utilization, we need biomarkers that obviously involve creatine phosphate, and we need biomarkers that involve capillary increases via blood flow and the dynamics within these vessels. So the nutrition, ions, everything that comes along with the blood as well, to the eyes peripherally. So we see all of a sudden that, okay, it's almost pre-selected for us now. We see that there's going to need to be the ever so slight of an amygdala function, not enough to induce changes in oxygen utilization or actual hormonal changes that go through neurochemistry that might decrease precision. We need just enough excitation there, but what we really need is a very red hot motor cortex, an auditory cortex, and our kinesthetic awareness maps to be as sharp as possible. That's why, just like in bowling and darts, they talk about their stance. Their stance is associated with increasing these 5 senses and so on and so forth. Then what you do is listen. So let's listen in the sense of what behaviors and what sensations are already happening. So if you are now, let's flip the script. Maybe you are after the gym and you are looking to modulate vagus nerve function to increase tone again and get blood to your stomach so that you can eat and breathe and all these great things. Now we need to ask ourselves, am I actually in a state where there's not enough blood in my stomach to digest? Or is my respiration rate off enough that I can't have the blood flow increase I need, but I am deep down kind of hungry? They're 2 sides of the same coin, but you need to see what's going on and just be intuitive and mindful. Lastly, we're going to decide. So, if you feel that you're genuinely very, very hungry, and you take your heart rate and you notice it's a little bit lower than normal, and you're like, okay, well, that means there's going to be greater vagal tone than normal. Maybe along with this, we see a blood glucose level that's a little bit low. The appetite is explained, and you could subsidize the need to feed yourself then based on this data. Whether you want to overfeed or underfeed, they can both be defended by now concrete data you identified. You understand what's optimal for what you want to do, and then you saw what is already happening. So if we want to increase expression of vagal tone, one of my favorite modalities here has to do with combining either meditation and nasal breathing with some type of supplement. They're going to be different. Meditation is going to have more to do with quieting white noise in the brain and with allowing respiration rates to return to normal. If we see an increased respiration rate per minute, we're going to want to drop that logically if our goal is to increase vagal tone. Nasal breathing is very different. Nasal breathing might actually impede a little bit of your pushing of the vagal tone, but what it will do that fosters it is that it's going to change peripheral blood flow and open up the everything having to do with movement of oxygen and hemodynamics downstream. This is an excellent way to change blood pressure and to, more importantly, train oxygen utilization over time. Excuse me. So if you already have some of these skills and you simply realize that I'm just in a little bit of a sympathetic state and I need to reduce that, and again, you have the skill already, nasal breathing is what I would select, and then maybe you'll go along with a little bit of ginger extract or a little bit of chromium or a little bit of dihydroberberine. Any of these three things are going to foster and decrease the cost of nutrient utilization, which is going to allow you from a second-hand mechanism to then express hunger a little bit better, which is going to increase through secondary mechanisms again, the expressions of vagal tone. Now, if we want to alleviate vagal tone, it's actually very different. Alleviating vagal tone, meaning driving the sympathetic nervous system, is actually a lot easier because we have far more hormones to induce this. We tend, as human beings, to have this increase in vagal tone as our baseline, and we simply push on the brakes to get into our sympathetic state rather than hitting the accelerator. And that's a very, very, very important thing to keep in mind. We at rest are actually hitting the accelerator, and the accelerator is the expression of vagal tone, which allows us to rest and allows us to digest and restore and all of these wonderful things. It's where the immune system is going to thrive. When we hit the brakes, we are actually then kind of unleashing this primordial beast from a hormonal perspective, and that is what is often counterindicated with your ability to digest and do the things I just mentioned. We have two different sides of that same coin for a reason. As we now shift into the hypothalamus, let's take the same approach. Let's identify what do we want to have our hypothalamic activity to be defined as. For example, if your goal is to ultimately lose weight on the scale, and we apply all the second, third order action things we've talked about, you first need to recognize that 1, we need to have a hypothalamus that is going to foster our ability to utilize fatty acids and be sensitive to hormone-sensitive lipases and be sensitive to catecholamines secreted from the pituitary gland and our adrenal gland so that we have proper response systems. Now, if we start to dive into specifically what can help the fostering of weight loss on the scale, whether it's body fat or not, when we look at the hypothalamus and the stressors we should input onto it, it's actually going to have to do with a couple of things. 1 is going to have to do with having an ability to have a hormonal response curve, meaning if you secrete a large amount of catecholamines via norepinephrine, epinephrine, whatever have you, you need to be able to bring that back down without having a second secretion of them. The way our nervous system, and specifically the sympathetic nervous system, works, because again we're hitting the brakes, it's like hit the brakes, start listening, if you will. And the waves of stressors input on you by the world around you are going to have the sympathetic nervous system secrete response waves of catecholamines and thus glucocorticoids downstream and all this stuff as well. So what that means is the same waves of pressure with time in between put on you are going to be the same waves of pressure we respond with in the sympathetic nervous system. Now, where the hypothalamus comes in here is that it's going to have the raw backbones for cortisol response systems and for metabolic and enzymatic usage to bias the vagus nerve inherently in our response to the world around us. So, if we are going to be talking about your ability to respond to a training stressor, and we're going to talk about how you can function under varied amounts of food with that training stressor. This is going to be where the hypothalamus' training, if you will, comes into play. Again, we're looking to foster weight loss, right? So what stressors are going to foster this? We would want to do some type of restorative work under a food-deprived state. It doesn't have to be extreme, but just 20%, and ensure that you still get a restorative response. This is going to bolster acute immune system function as well as ultimately give the hypothalamus a tally mark for training it the way you want to. Conversely, you should be able to be 20% hyperfed and have an increase in performance in glycolytic or emotionally invested exercise. And if you can do both those things consistently, then you will be able to, at any point in time, either shed water or body fat due to food and water manipulation exceptionally easy. And this is what weight cutting is about. Weight cutting is about the quality of hypothalamic adaptations you've made over time and when the vagus nerve gets clicked on or off with it. So what we now need to do is look at this identify, listen, decide matrix I've given you at the bottom of the PDF and talk about it in a slightly more chronic view than the vagus nerve. That was very quick and short. We called that hourly, right? With the hypothalamus, we are now looking at strings of 4 to 6 or 7 days. Now, over the course of 4 to 6 or 7 days, you identify what are the optimal behaviors, biomarkers, and enzymes, as we've talked about, in response to the nutritional, metabolic, and exercise-based stressors put onto us. Then we are going to look at our data and see what is already happening. So if in response to the low food, low intensity restorative session, you had increased heart rate that was the same as the overfed, overtrained, hypercaloric, high intensity training session protocol I talked about, we're going to see that there's a discrepancy there and we need to fix that. So then we jump into decide right away. Are the data, points, and feelings I am having associated with what I see proper? And that's where you decide, do you jump in or go numb? Do you decide that these appetite feelings are actually the response I want, and this hunger is good in fact, or bad? This is the step process you have to do to determine if you should or shouldn't over or underfeed at key points in time. Now, when we talk about the management of underperformance and the management of feelings in sport, I actually feel we can still use these 3 bullet points. And it's going to be really cool now when we talk about them from a coaching and a little more phenomenological perspective. Let's identify why someone underperformed. So what were, now we're talking the past tense, ideal behaviors, biomarkers, enzymes, etc., that we should have seen? Now, listening is now in the past. So what did in fact happen and what perception did the athlete have that caused them to perform in such a manner, and why was it different than the relative prediction of optimal we had for ourselves? Then you decide the connotation associated with the underperformance, as well as how to perceive and tackle it. Just because a score sheet says something doesn't mean it's always necessarily true when we come back to what do we do next in training. If you won, it doesn't mean everything you did was great. And if you lost, it doesn't mean everything you did was useless. Those are in the moment paradoxes. Performing in sport is a momentary expression. It has much, much less to do with planned orientation than we want to believe. Planned orientation gives us sustainability, it reduces injury rates, it allows us to perform more consistently and at a lower cost, but what happens is 100% different than that. Sorry I keep getting on those rants about it, but it's a entirely different subject. It very much is. So, now let's go through this with a real scenario quickly. Let's say this has happened to me many times in strongman. You've essentially won the first 3 or 4 events and you are in first place by several points. Going into the last event, you bomb it, you end up taking second overall. Let's look at this. We need to identify what was the optimal behavior. So, if you're in first place, the optimal behavior needs to be data driven, knowing exactly what number you need to hit, and it needs to be intimately balanced with a calmness where you keep aggression in your back pocket. So, what that means is if you recognize you need to do 7 reps on something, and you are in first place and it's something that you should be able to do, that means that the first 2 to 4 reps involved should have to do with positioning yourself optimally to win the event or get close as you need to get. So they're kind of just figuring out what's going on in a positive manner. Then you take out the aggression at the last moment so that you can finish with finesse, security, and ensure that that last rep gets done. The last rep is difficult for everybody. The last rep is its own in-the-moment physiological phenomenon, and that's what needs to be approached if you want to secure first place in any sport, actually. Then we listen. Well, what in fact happened? Oh, well, when we look at it, you actually flip-flopped. You started hyper-aggressive to maybe convince yourself that you could do it, and because you lacked authentic confidence, and that meant that plus the drive of being in first place and everything, you actually got through your creatine system too quickly, got too deep into glycolysis too quickly, and all of a sudden, now the setup you had to secure your victory feels much more like a fear-based amygdala drive than an aggressive one because you have less oxygen than anticipated on something that should have been easy, and you feel it slipping away, and you don't know why you have this sudden rush of fear. So then when we decide what to do, we should be looking back and talking about strategy execution in the moment physiological consistency, and of course you can reflect that in your training, but that does not mean there is anything wrong with your training. In fact, it might be great if you're doing this well. Lastly, we need to cover how to identify what encompasses your arousal curve, and that's what feelings do. Meaning, as a sports performance coach, in the moment, you could say, we need an amygdala-driven, exciting, very aggressive arousal curve. But I can't tell you how to fill in those blanks. That's your job as the athlete. So when it comes to feelings and filling in the blanks for your arousal curve, identify, once again, what are the optimal things that fill the strategies I need? So if the strategy is calm first, aggressive second, the feelings that you would want to identify with are confidence, are feeling like you are going to execute the task, precision, a stoic face with a calm gaze. You would not want to identify with fear, with hyper-aggressiveness because of the strategy we identified. Then you would listen and say, well, as I sit in a brief moment of meditation, what are the loudest things on the TV? Then you decide, Should I jump in and go with these emotions, or should I quickly numb myself to them and let them pass because I have not identified them as optimal to myself? And it's a funny way to start ending the episode because in the moment physiology involves roughly half momentary allostatic biology, where allostasis is the language for biology to communicate with sports performance. And on the other half of it, it's this very phenomenological, athlete driven mindset and somewhat metaphysical based drive that gives an equal and reciprocal force back into that allostatic biology. And that intersection is where performance actually happens.